Hello everyone, and I, Dr. Nikita, welcome you in my online pharma channel. Kindly like, share, subscribe my channel and keep watching my channel till end for better understanding of the topic. We are going to see what are the different dosage forms. Okay, so on this screen you can see many packages which you have used for the medicines. Okay, you can see this bottle which is for eye drop, then capsule you can see, this is a capsule you can see, then these are the tablets which you can see, injection you can see, liquid bottles, then you have this container for the solid powders. You were small, you used to have liquid formulations like syrup, suspensions, then you have solutions, drops. When you grow up, you switch to tablet dosage form, capsule dosage form, powder dosage forms. So, and again, some elderly patients prefer to have the liquid dosage form. When your health conditions are very severe, you have the high fever, you switch to injections for the early recovery. Okay, so these are the various forms of the dosages through which you take the drug, and we are going to see these different forms of the dosages which are they. So whenever you prepare the dosage form, there you have the two ingredients. One is drug and another one is the excipients. So drug is the main ingredient which will give the therapeutic effect, which will help to overcome the illness, and excipients are the ingredients which help to make up the dosage form. So in a suitable form, you can take the drug. So what is the drug? So drug is any chemical agent which you use to diagnose, mitigate, treatment, and cure of the disease in man or animal. So you are using this drug for the diagnosis to detect what is happened, then mitigation to decrease the severity of your disease condition, treatment to treat the disease condition, and to cure the disease condition in man or animal. So now, what are the different sources of the drug? You know, in Ayurvedic medicine system, you have drug from various sources, a plant source, you have animal source, so you have various powders, herbs, extracts, which you are obtaining from the plant. Then from animal source, you have various powder drug like calcium you get from the animal bone, oils like fish oils which you get from fish. So these are some drug or medicines which are obtaining from the animal source. Nowadays there are many uh, drug available from biotechnology source, and you get by the genetic modification various vaccines are prepared. Then you have microbiology source, that is by fermentation of process various antibiotics are getting prepared. So microbiology, biotechnology, these are also the various sources through which you can obtain the drug. Okay, now this word droge means the herb, dry herb. So this is a French word which indicates the dry herb, and from this word, our word drug is derived. Okay. Now you have the dosage forms. So what is dosage form? Drug you cannot take as it is in a powder form or a liquid form. Okay, suppose you have any drug powder and you are feeling sick, you have paracetamol powder and you are feeling like fever, so that spoonful of powder you cannot take and you will feel relief. So that powder, which is the paracetamol powder, you have to give in a suitable form which you can take, which you can give to the suffering patient. So when you convert this drug into the suitable form which you can handle nicely, which you can take, it's called as the dosage form. So as per the definition, dosage forms are the physical form by which drug is given in right quantity at right time in a right way to get the desired therapeutic effect. So you have that right site, right time and the right quantity to get the desired therapeutic effect is called as the dosage form. Now, next you have the, and for the marketing also. So when you are going to sell the drug, you have to prepare drug ingredient into suitable formulation form. Next you have various examples of the dosage forms like tablet, capsule, syrup, injections. So these are the various forms of the dosage forms. Now you have the excipients. Now this excipient is the other than drug part. Whenever you are preparing the formulation, you add drug and other ingredients which are called as the excipients. And these excipients should be safe to use. They should not have any interaction with the drug material. They should not impair stability of the product. They should not have any their own therapeutic action or their own adverse effect. Your excipient should be tested properly so that it should not have any effect on patient health. So they should not affect stability of the product. They should not alter the appearance of the product. They should not alter therapeutic benefit of the product. So this term is a Latin term, excipier, which is meaning other than or the except. So other than drug is called as an excipient and which are used to make the formulation. So excipients plus drug which will give you the dosage forms. Okay, so a simple example I give you, the you eat the bitter gourd vegetable. Bitter gourd vegetable, you simply cannot cut the bitter gourd and start eating bitter gourd as a vegetable. So to make it eatable, you add onion, tomato, ginger, garlic, various spices, and salt, pepper, sugar, whatever you add in it, and you make that bitter gourd in a suitable eatable form. So bitter gourd is a drug, but the vegetable, by adding so many things into it, it becomes the edible form vegetable, which is like your dosage form. So you have drug, which is the whole one ingredient, but you add excipients to make it suitable to administer. These are the excipients, and then total drug plus excipients give you the dosage form. So you have, for same drug, you may have different dosage form. So for the paracetamol powder, you can have syrup, you can have tablet, you can have injection, you can have suppositories. So these are the four dosage form for the same drug. Like same bitter gourd, you can eat in the form of a juice, you can eat in the form of the bitter gourd vegetable, you can eat in the form of the fried bitter gourds. So these are the 3 to 4 forms of the bitter gourd which you are eating. So you understood the concept of dosage form, that drug plus excipients gives you the dosage form. Drug is the active ingredient and excipients are the other than active ingredients which help to make up the dosage form. Next, you have what are the need for formulation of the dosage form. Many drugs are available. You can, but you cannot eat the spoonful or the 3 drops or 4 drops of the dosage form. You need to formulate in a suitable form. So these are many needs. First is the accurate dose. Okay, so you should not, or you should not have the less quantity or more quantity. If it is less, then it will not have therapeutic effect. If it is more, then it may have toxic effects or toxic effect of that drug. So you should have accurate dose to exert the desired therapeutic effect. So dose strength is always mentioned onto the dosage form. So based upon your weight, based upon your age also, the proper dose is calculated, and upon that the medication is given to the patient. So it is very much required to have proper therapeutic effect with the accurate dose of the drug. Second, you have protection from the environmental factors. So these drugs are the chemicals. They may have various stability parameters or stability issue with the environment. They may be hygroscopic, may absorb moisture and may undergo degradation. Photosensitivity, they may undergo degradation by exposing to the sunlight. Then this oxidation, when they comes in contact with the air, they may undergo oxidation and their potency may change. So these are the various environmental factor So to prevent this degradation from this environmental factor, you have to prepare a suitable dosage form. Like tablets are coated with the polymer to avoid the effect of moisture on the drug. Whereas coating is getting applied onto the drug particle or drug granules like microencapsulation, the polymers coating is applied, so which will prevent the various environmental factor like oxidation, hydrolysis, even photodegradation is also avoided by the polymer coating. Next you have is the protection from the gastric juices or the enteric coating. So whenever you eat anything, first it goes to the stomach, and your stomach are having many acids, and some drug may undergo degradation in this acidic condition. So it is better to release the drug in intestine and have the effect of the drug in the intestine. So when you have this degradation problem in stomach, you can coat with the polymer which do not release the drug into the stomach, but they release the drug into the intestine. So like that you can prepare your dosage form. So avoid degradation of a drug in the stomach part, but liberate the drug into the intestine, and you will have the good therapeutic effect. Next, you have the palatability, that is the good acceptability. Your drugs are the chemical agents. They have some taste, odor, or some unacceptable color also. So, if you have very bitter taste and if you have oral formulation, it is very difficult to swallow. If it has obnoxious smell, again it is difficult to swallow. So various other agents are added like coloring agent, flavoring agent to the formulation, and to change it or make it acceptable to the patient, and to increase the acceptability for that particular dosage form. Have the sustained release and the controlled release. You know that conventional dosage form like your simple tablet, simple capsule, when you eat, they break into the small particle into your GIT, and the drug is absorbed into the GIT. But in certain condition, you require to maintain the level of the drug into the blood or into the plasma. So to maintain required level or constant level, or the release of the drug is maintained to require, you need to formulate the drug into controlled release or sustained release form. So these are the various dosage forms where the drug is released over a period of time. Next, you have optimal effect for same drug in a different formulation. I told you that bitter gourd you can eat as a juice, you can eat as a vegetable, you can eat as a chutney, or you can eat as a fried. So one vegetable made into different form. So paracetamol you can make as suspension, syrup you can make as tablet, suppository, and injection. So same drug we are making in a different form. If you take tablet and syrup, then you will have less absorption. But if you take suppository, you have more absorption. If you take parenteral injection of paracetamol, the absorption is very fast. Okay, so you have optimal effect from the same drug with a different formulation can be achieved. Insertion of the drug into the body cavity. Now you know that drugs are also introduced into the vaginal body cavity, then rectal body cavity. So in that cavities, you have to introduce the drug into suitable form. Just powder you cannot insert. So the powder drug is formulated in such a way that they can be inserted into the body cavity, and you can have the systemic or local effect of that drug. Improves the patient compliance. Okay, so when you prepare the tablet, when you prepare the dosage form in a friendly manner, it accepts the compliance of the patient understand in a better way how to take it, and it helps to understand the medical advice properly and to follow it properly. So it helps the patient compliance for that medication therapy when you formulate in a suitable dosage form. So these are the various needs for the dosage form. Now, what are the desired property of the dosage form? So first, it is convenient to handle, use, and store. So it should be convenient to handle. The tablet which you prepare, it should be of sufficient size that it should not very difficult to swallow it. Okay, for child or elderly patient, it is very difficult to swallow big size tablets. So it is easy to use, then easy to store and convenient to handle, then stable during the storage condition. Now if your drug has a particular shelf life, that is it's a stability. If it is unstable during storage condition and you are taking the drug during that condition, then it will not have proper therapeutic effect. So it should be stable so that it will give the proper therapeutic effect. Next you have withstand the mechanical shocks during the transport. So if you prepare the tablet dosage form and you pack it, and during the transport or handling, if the tablets are breaking into the packages and those packages come into the patient hand with a broken tablet, it is not acceptable. The patient do not feel like taking those broken tablet. Okay, so the formulated for dosage form should have sufficient strength, sufficient power to withstand the jerk, withstand the shocks, and to maintain the integrity of the shape of the product. Next, you have provide effective therapeutic effect. I told you that the accurate dose should get administered, and it should have that proper therapeutic effect for that benefit of the patient. If you have less therapeutic effect, then you will not have that health benefit. So whatever drug you are taking in a suitable dosage form, it should give the proper therapeutic effect. Okay. Next, we have extent of the drug release, onset, intensity, duration of action is predictable. So when you administer the drug, it has some pattern which it follows. It first absorb, then distribute, and then it starts eliminating from the body. So for particular drug, you know at what time, how much time is required to absorb into the drug, how much amount is getting absorbed, how much amount is getting eliminated, at what time it starts eliminating, and what is the time when it gets completely eliminated. So this data helps to predict the behavior of a drug in a human body. Then you can predict the fate of drug when it is administered. So these all parameters must be measurable when you administered any drug in a suitable dosage form. You have economic and manufacturing cost. Okay, whatever drug you are manufacturing, it should be economic, it should be budget friendly, it should be pocket friendly to the patient, so that it will have, the patient will not suffer economically to have any treatment for any disease. So whatever, because the drug are very important and they have the health benefits, so they should be pocket friendly, budget friendly to have treatment for all group of people. Okay? Kindly like, share, subscribe my channel, and do not forget to post your comment, and keep watching my channel till end for the better understanding of your topic. So thank you for watching, and keep watching my channel. Thank you. Welcome. Thank you very much.